In 1994, the American Academy of Pediatrics introduced the Back to Sleep program as a way to educate families as to the importance of back sleeping in order to reduce sudden infant death syndrome, also called SIDS. Since its implementation, the rate of SIDS-related deaths in the U.S. has decreased over 50%. With the success of the program, the United States has also seen a rise in deformational plagiocephaly and brachycephaly caused by prolonged supine positioning while sleeping. This sudden increase in children with proportional and asymmetrical deformities of the skull led parents and healthcare providers to find a safe, non-invasive, and effective method to correct this rising problem. The Starband cranial remolding orthoses from Orthomerica products was developed and cleared by the FDA in 2000, and the Star-Scanner laser data acquisition system was created and cleared by the FDA also in 2001. Orthomerica Products has been the worldwide leader in providing cranial remolding orthoses with the Starband and the Star-Scanner system. Orthomerica's Starband products are all provided by ABC certified and/or licensed orthotist or prosthetist who have completed a residency and have completed Orthomerica's cranial certification course. All practitioners providing Starband products must remain current in their respective certifications and complete continuing education courses in cranial remolding therapy.
To begin the educational portion of this video, we will begin by discussing how helmet treatment works. Each child who comes to a Star-Scanner location for a cranial evaluation will be measured with the Star-Scanner laser data acquisition system. The Star-Scanner is a series of cameras and FDA-approved eye-safe lasers that take a 3D picture of the child's head and face. The 3D image is then measured by the computer. Each child's measurements are then compared to standardized severity scales for cranial asymmetries and proportional deformities. Once the necessity of helmet therapy is determined, the 3D image is then used to fabricate the Starband. This image will be sent to Orthomerica for fabrication. The 3D image is carved into a replica of the child's head and is then modified to the desired shape. The Starband is then pulled over the corrected symmetrical model of the child's head. The areas that were built up to create symmetry will then be a void inside the helmet where corrective growth can occur, and the helmet will only be contacting the head in the areas that we want curbed growth. The Starband is fabricated with a half-inch layer of foam that can be modified throughout the whole treatment as the child fills in the void with corrective growth, thus eliminating the need for several helmets to complete helmet therapy. As treatment is growth dependent, the duration of treatment time is on average between 2 and 6 months, dependent upon the severity of the head shape, the age of the child when treatment begins, and the compliance of the family, which is 23 hours a day wearing schedule. Throughout treatment, scans will be taken and compared to the original scan in order to track the efficacy of treatment. To begin the scanning process, a stockinette is placed over the child's head and markers are placed at the ears. The stockinette holds down the child's hair and allows the scanner to take a smooth, accurate image of the cranium. The markers at the ears help practitioners to consistently place landmarks in the scan for comparative studies during treatment. The child is then placed in the scanner with the mother holding the baby at all times, or the practitioner distracts the baby's gaze into a neutral alignment as the scanner's cameras pass by the child's head. The scan takes less than 2 seconds and is accurate up to 0.25 millimeters. The laser lights in the Star Scanner are all Class 1 FDA cleared medical lasers that are no threat to the patient's eyes. In the Star Scanner, unlike an X-ray and MRI machine, there is no concern of exposure to the patients as no eye protection is needed. Once the scan is completed, the practitioner places pertinent landmarks on the 3D image, and the scan is then opened in the other software called the Cranial Comparison Utility. This software is used to evaluate the cranial symmetry and proportion throughout the whole treatment process. There are 4 different types of deformational cranial anatomies that we must discuss. Those are plagiocephaly, brachycephaly, scaphocephaly, and asymmetrical brachycephaly. Plagiocephaly literally means parallelogram head and is characterized by an asymmetrical presentation of the cranium, where one side of the head is flat on the posterior, and the congruent side of the head is then bulging or prominent at the front of the head. Brachycephaly and scaphocephaly are both proportional deformities. Brachycephaly being where the head is wider than the normal limits of proportion, and scaphocephaly being the opposite where the head is longer than the normal limits of cranial proportion. Brachycephaly with asymmetry is characterized by a wide head shape with flatness on one side of the back of the head. Each child's proportion and symmetry is measured by the scan and discussed with the parents to determine the necessity of Starband treatment and what aspects of the child's head shape need to be improved upon. To determine the asymmetry of a child's head, diameter measurements are taken on each side of the head at equal angles, and the difference between the two measurements is called the cranial vault. The proportion of the child's head is determined by dividing the width of the head by the length and multiplying this by 100. This number is called the cephalic ratio. The cranial vault and cephalic ratio are tracked throughout the treatment with comparative scans. Your practitioner will take scans at follow-up appointments when a significant amount of growth is measured in the total circumference of the head. These follow-up scans will be aligned with and compared to the original order in order to accurately track the growth in desired areas and to ensure growth is being curbed in the holding areas. Every time a scan is taken, a STAR scanner summary report with the measurements and a cross-sectional view of the child's head shape is given to the family and the progress is discussed. The Starband orthosis is fit approximately 8 to 10 days after the scan to order appointment. It is important that the Starband is fit in a timely manner after the scan to order as the head continues to grow. If too much time lapses between the scan and the fitting of the Starband, there may be significant alterations that will need to be done to properly fit, and to get a good clinical outcome may be compromised. The fitting appointment lasts approximately 1 to 1.5 hours to complete any needed adjustments to the fit and to spend time educating the family as to proper wear and care techniques. Once the child is fit with the Starband, they'll begin a break-in period prior to beginning full-time 23-hour-a-day use. This break-in regimen is designed to acclimate the child to the helmet and to ensure there is no excessive contact at the holding points. It is also important to note that your baby may sweat excessively in the Starband the first week or two, and this is normal as the body adjusts to having the head covered 23 hours a day. Please dress your child in light-wearing clothing to allow them to cool down during this period of adjustment. The child will wear the Starband alternating on and off throughout the first 4 days of treatment, with the periods of wear increasing each day. Day 5 is the first day of full-time use, with every day thereafter being 23 hours of wear time. As we have previously mentioned, having your child be compliant with the 23 hours a day wearing schedule significantly reduces any potential excessive contact pressures. But parents must be educated as to what the skin under the Starband should and should not look like. First and foremost, redness of the skin at the holding points are completely normal, as long as it fades to pink within the first hour. Your practitioner will explain to you at the fitting appointment where on your child's head you should expect any type of redness. Another excellent way to determine if redness is excessive is to see if the red area blanches. Press on the red spot with one finger for about 2 seconds, then remove your finger and see if a white spot was created from the pressure of your finger. The white spot will then fade back to red. If this occurs, then the red spot is appropriate. If you press on the area of redness and blanching does not occur, and pressure from your finger only increases the redness, please make an appointment with your practitioner for an adjustment. If this occurs, then the red spot is appropriate. If you press on the area of redness and blanching does not occur, and the pressure from your finger only increases the redness, please make an appointment with your practitioner for an immediate adjustment. Other types of redness, such as irritation, may occur on the baby's skin during treatment, most of which are normal and may occur at any time during treatment. Sometimes occurring the first week of wear, other times months into treatment, both of which are normal. Heat rash and eczema are the two main issues that affect babies in helmet treatment. Heat rash often appears as pimply, blotchy patches of redness over the entire head that usually fades during the hour break. It may be more concentrated at the holding points. Eczema is a type of dermatitis caused by dry skin. This type of redness most often appears on the cheek extension and across the back of the neck, and occasionally the forehead. It is most characterized by raised, flaky, irritated patches of skin. Many children will scratch at these areas, which may cause further irritation. In order to relieve eczema or excessive dryness, we suggest speaking with your practitioner or pediatrician for possible solutions. Occasionally, children may develop a patch of yeast on their skin. Yeast occurs at the holding points on the cheeks and the back of the neck. Visually, yeast may appear as eczema and will itch, but is characterized by a yellowy discharge on the inside of the helmet and a sour odor. If yeast is suspected, talk to your orthotist, and a trip to the pediatrician may be needed to remedy the condition. Following the cleaning protocols greatly reduces the chances of developing a skin yeast infection. When putting the Starband on your child's head, there are 3 main steps. Open the helmet at the side opening and slide the helmet over the baby's head. Check to see the front of the helmet is about 1 centimeter over the eyebrows and the clearance for the eyes is even. Finally, Velcro the strap in place. Remember, each Starband looks different on each child, as all Starbands are custom made to correct each unique baby. Your practitioner will explain the fit of your individual orthosis. Many parents are concerned they may tighten the Starband down too snug. The Starband is fabricated with a foam stopgap at the opening that does not allow you to tighten the Starband past the circumference it is set to. Remember, we are not squeezing the child's head into shape, but just gently guiding the future growth. You cannot pull the strap too tight, and there is no need to pull hard on the strap to keep the Starband on the child's head. It is how the Starband fits on the inside that is suspending the orthosis on your child's head. The Starband is lined with a hypoallergenic closed-cell foam that is easy to care for. The Starband must be cleaned daily during the hour break. For the first 2 weeks of wear, the Starband must only be cleaned with rubbing alcohol and a washcloth or soft bristle toothbrush. We suggest having the rubbing alcohol in a spray bottle and begin by spraying the inside of the orthosis evenly. Do not be afraid to give the foaming a good scrubbing with the washcloth or toothbrush in order to remove any buildup of body oils and odors. The rubbing alcohol kills any germs that may grow in a warm, damp environment, such as the inside of a Starband. As for bathing your baby, we strongly suggest not making any changes to your child's current bath schedule the first 2 weeks they are in the helmet, as using a new soap or increasing the frequency of bathing can cause a skin breakout that is not necessarily related to the Starband. After this 2-week period, it is usually safe to increase frequency of bath time and possibly change soap products as the parents deem necessary. Unfortunately, most Starbands do develop an odor over time. In order to eliminate odor, we suggest leaving the Starband in the sun after cleaning it during the hour break. Although it may be tempting, please do not clean the helmet with any product that you would not clean your baby's head with, as it may leave a residue, causing a global skin breakout on your child's head. Once it has been established that your baby's Starband is fitting without any excessive contact issues, you may gradually switch soap products to help eliminate odor on your child's head. Please ensure that the Starband and your child's head is completely dry before reapplying the orthosis. If necessary, a cool hair dryer can be used to dry your baby's hair and the inside of the orthosis. Please do not use hot air or hot water to clean and dry your child's Starband, as heat can damage the foam lining. As for the outside of the Starband, a damp cloth is sufficient to remove any food or baby smudges. Proper hygiene during Starband care is important, because without regular cleaning, skin yeast infections and other types of dermatitis can occur that may force your child to be out of the orthosis while the issue is resolved. And time out of the orthosis is detrimental to the success of the treatment. If you have any concerns regarding your child's skin during treatment, please contact your practitioner for advice. As we have already mentioned, the full-time wearing schedule for a Starband is 23 hours a day. We understand that having your baby in a Starband 23 hours a day may seem like a daunting task, but after completing the break-in schedule, children acclimate easily to wearing the orthosis. Children are growing very rapidly at this age, and growth occurs all the time. The 23-hour-a-day wearing schedule allows the orthosis to guide every millimeter of growth to occur in the desired areas. Even more importantly, the 23-hour schedule significantly reduces the potential for excessive contact pressure to occur. If the child does not wear the Starband for even a couple days, growth can occur in the prominent areas, and when the helmet is then worn again, it may cause excessive pressure at the holding points. It is important to contact your practitioner if your child has to be out of the helmet for longer than 2 days. The Starband can only be removed for 1 hour per 24-hour period for bathing and cleaning of the orthosis. This 1-hour break can be broken up into 2 30-minute periods, as these breaks should be taken at approximately the same time each and every day. If your child has a fever of greater than 100 degrees Fahrenheit, the Starband should be removed until the fever breaks. Children may get many colds at this age, and we encourage parents to continue full-time use in spite of a runny nose and cough. Many parents are concerned with their child wearing the Starband at night. Nighttime use is the most important time for the child to be wearing the Starband, as this is when deformational forces from the mattress are contacting the head. The orthosis eliminates these forces on the skull, and many parents find themselves relieved that they no longer have to worry about repositioning their baby at night to avoid their child sleeping on the flat side of the head. Not only is wearing the Starband 23 hours a day imperative to the success of treatment, but so is maintaining a regular follow-up schedule with your child's orthotist. Once your child is fit with the Starband, a 4 to 7 day follow-up appointment will be made. At this appointment, parents are able to discuss any issues or concerns they may have after completing the break-in period, and any needed adjustments to the fit of the orthosis are made. After this initial follow-up appointment, children are seen back every 2 to 4 weeks depending upon their age.